All right. So get ready. It's Let's Talk Business with Cheryl J. Cousseau. And we're here for the second hour of the show with my co-host, Dr. Sinead Davis.
Hello, everyone. Happy Colon Cancer Awareness Month.
Only she could say it that way. And the other person that will come and say it even differently will be our guest. And let us take this opportunity to welcome Dr. Donna Powell to the show.
Good afternoon. Thank you so much for having me today.
Listen, it is our pleasure. Our audience is going to be wowed by the information that you're going to be sharing. Every minute is critical. So here's what we want you to know about Dr. Powell, and we will put her full bio up so those that want to delve a little deeper into who this amazing doctor is. She is a board certified in both gastroenterology and internal medicine. We will give a shout out for her undergraduate to the institution of the University of South Florida. Go Bulls!
Bulls.
Dr. Powell is married with 3 children. She enjoys spending time with her family, especially taking family bike rides and going to her children's sporting events. She also enjoys competing in fitness competitions, dancing, cooking, and making people laugh. Again, welcome, Dr. Powell. I'm going to turn you over to our best in the house because this is the show where we will be all up in your medical business today, specifically colorectal cancer and bringing awareness. Dr. Davis, take it away.
Hey, everybody. Thank you so much for your attention and joining us for this Colorectal Cancer Awareness Month, but it's also Women's History Month. And it was probably a couple years ago when I realized that Tampa actually has an African-American female gastroenterologist. Usually gastroenterology is a specialty profession that we see many male physicians in, but for those of us that really like to have a woman's touch, a woman's opinion, particularly a minority opinion, Dr. Powell is right here in our hometown, and we just thought it really important to bring her on to increase visibility of her wonderful practice, new and on her own, Gastro MD. Is that right, Dr. Powell? That's right. So anytime that we're going out, as Black business women, we want to make sure that we are lifting each other. But when we are providing a service that our community absolutely needs, particularly when it comes to prevention and where we have high risk, we want to make sure that you know who's out there and what we can do for you. So it's Colon Cancer Awareness Month. Tell us about the basics, what it is, and what we need to be doing in order to, be proactive in terms of prevention.
Yes, ma'am. So, the reason why, Colorectal Cancer Awareness Month is so important is because colon cancer is the 3rd most common cause of cancer behind breast and lung in women and prostate and lung in men. And it is the 2nd cause of death amongst all cancers. But, the most incredible thing about colorectal cancer is that it's also one of the most preventable, believe it or not. There are certain risk factors that can increase our risk for colon cancer. And these include being obese or overweight, living a sedative or inactive lifestyle. That means not working out. Diets that are high in fat and processed or red meats, or a low fiber diet. Smoking, of course, heavy alcohol use defined as drinking at least 2 drinks every night. Low vitamin D levels, being over the age of 45, having a personal history or family history of colon cancer or colon polyps, having a history of inflammatory bowel disease. There are certain genetic syndromes that can predispose you to colon cancer, in which you can develop many, many polyps in the colon. And most importantly, being African American. African Americans have the highest incidence rate of colon cancer and the highest death rate amongst all other nationalities. And so it's very important that we stay on top of how to, fend ourselves off from this cancer. So you may ask, well, you mentioned that it can be preventable. So how can we prevent this thing? So there are several screening tests that are done currently to help detect and prevent colon cancer. So let's talk about the stool test first. Okay, so there are several different stool tests. One is called a occult blood test. And this is typically ordered by your primary care physician, usually once a year. And these are those little cards where you're having to scrape your stool on there and you turn them into the lab. And basically, they're looking for microscopic blood. This microscopic blood could be from anywhere in the gastrointestinal tract. So it's not specific to the colon. And also, these tests can be affected by diet and medication. So although this test is helpful, it's probably not the best test that we have. Another type of stool test is called the FIT test. And this is also a test that's often given by your primary care physician about once a year. And this test is a little bit more specific. It tests for microscopic blood, mostly from the colon. Okay. And if they detect blood on one of these stool tests, then the recommendation is that you should have a colonoscopy. Another popular stool test that you hear a lot of people talking about, you see a lot of commercials about, is something called the Cologuard test. And you've probably seen commercials where you know this kit in the mail and you put your stool in the mail and they tell you whether you have cancer or not. So this test specifically detects microscopic blood or DNA that can be shed by polyps, which are small little growths that can turn into cancer, or by cancer in the colon. So if the thing about this test though, however, is there can be some user error, okay, regarding getting those stool tests, processing in the mail, what have you. There also is a higher false positive rate with this test. And this means that people are testing positive who may not necessarily be positive. The other issue with this test is that it's not as accurate as we would like for it to be. So certain cancers and polyps can still be missed with this test. However, if this test comes back positive, once again, you need to have a colonoscopy. Another test that we use for screening is something called the virtual colonoscopy, which basically is a specialized CT scan that gives us a really nice picture of the colon and can help detect polyps and cancers. However, the limitation with this test is you still have to drink a bowel prep. So if you're doing it to get out of the bowel prep, not so
okay.
So bowel prep, if you have any polyps that are less than a centimeter in size, they typically cannot be detected on this test, okay? So although all these tests that we just talked about are very helpful with determining if some people have blood in their stool or maybe some early polyps or cancers, the best test overall is something called a colonoscopy. Most of us have heard of this. Some of us fear this. So I'm here to give you the tea on the colonoscopy, okay? It's not that big of a deal. I'm here to tell you, and I've done it myself, so I can speak on this. As far as the colonoscopy goes, what this is a procedure where we use a long, flexible scope with a light and a camera on the end. You are completely asleep. You don't feel a thing. You have the best nap ever. And this procedure takes about 20 to 30 minutes to do. And basically, we're able to actually visualize polyps or small growths in the colon. The importance of this is that most colon cancers start out as a polyp, okay? It takes a precancerous polyp an average of 7 to 10 years to develop into a cancer. So the whole goal of doing the colonoscopy is to go in there and remove these polyps before they have a chance to do so.
Wow.
All right. Also, to detect colon cancer at an early age. I must tell you that some people say, well, I don't need a colonoscopy. I feel fine. I have bowel movements like clockwork after I drink my coffee. Why do I need it? You know, I'm fine. I don't need it. I have to tell you, I have diagnosed several people with colon cancer with no symptoms at all.
Asymptomatic. Wow.
Majority of polyps have no symptoms. Okay. And so this is why starting at the age of 45, we recommend that you have a colonoscopy. People who have a family history, we recommend starting even earlier. For instance, if you have a first-degree relative who was diagnosed with colon cancer at the age of, say, 42, other brother, sister, father, you would need to start 10 years earlier at the age of 32 or age 40, whichever comes first, okay?
Dr. Powell, let me stop you
Yes.
for a moment, because I think that's a real important point that we used to, consider colonoscopies at age 50.
Mm-hmm.
Now we're, looking at age 45 because we're finding, that younger people are getting colon cancer. I've read with and I want to focus more on the colonoscopy because Dr. Gwede is also going to talk about, some of the FIT and the occult blood tests coming on after you. But I read that the American College of Physicians, because of the statistic that you mentioned, how the prevalence of colon cancer in African Americans, and also the higher mortality rates among African Americans, that the American College of Physicians recommends that African Americans actually be screened for colon cancer at age 40. And also, if there's a relative or first degree relative that had colon cancer diagnosis, that you start your screenings even 10 years before that. As we know, Chadwick Boseman died at 43, and then this is Black Panther to our audience. So,
We know.
we know it's T'Challa. T'Challa died, yeah, Wakanda forever. But no, he died at 43, and he also disclosed that he was battling serious treatment the 4 years prior to, his death. So he was before 40, he was younger than 40 at his diagnosis.
Right.
So can you talk about, those recommendations, and are we seeing that providers are actually referring for the colonoscopy in African Americans that early?
Okay, sure I can. So regarding the age recommendation for African Americans actually been 45 for about the last 5 years. So that's actually not new for us. But American Cancer Society and the US Task Force, American Cancer Society over a year ago came out and said they think everyone needs to be screened at age 45. And a few months ago, the task force also seconded that recommendation. And the reason for this is because we are seeing patients with colon cancers and advanced polyps at a much earlier age. And I cannot tell that over the past year, I've had several patients, I'm talking in their 30s and early 40s, and even a 25-year-old with colorectal cancer.
My goodness.
Physicians, although they are starting to recommend the age of 40, unfortunately, the other societies have not jumped on that bandwagon yet. And to be honest, when the American Cancer Society came out and recommended the age of 45, I was surprised because I thought that it would be 40. That's what I was hoping that it would be. And truth be told, when my husband turned 40, I made him get his colonoscopy because I think that should be the age as well, just because of what I've seen with younger patients in their 20s, 30s, early 40s with advanced polyps and colon cancers. So I'm hoping that, over the next year or two, that hopefully they'll even move that on down to 40. But it's definitely important to know your family history. So typically, like I said, for the first degree relatives, it's 10 years prior to their diagnosis or age 40, whichever comes first. And if you have 2 second degree relatives, then we recommend starting at age 40 as well. And typically we will monitor you every 5 years or even less than that, depending on whether we find polyps or not.
So you mentioned, and when you were going over risk factors, you talked about weight, being sedentary, your diet, having high processed foods, low fiber, low vitamin D. All of those are things that are closely aligned in people that have those social determinants that put them at high risk for all kinds of disparities. So would you say that some of those modifiable risk factors, if we can just, change that somehow or another, even if it's at a societal level, education or what have you, do you believe that would make a difference in terms of the risks that we see in African Americans, or the higher prevalence that we see in African Americans at younger ages?
I do think it plays a factor. I think not only is it African American because of some part of our genetic makeup, but I think also cultural wise, we like our soul food, we like our mac and cheese, our diet, fiber, and a lot don't have active lifestyles where we're actively working out on a daily basis. And just in general, 60% of Americans are obese. So these things definitely play a role, and these things are modifiable for a reason. And if we can at least, work on these things, then that's going to help to decrease our risks. And I did talk about this, but some of the I told you about some of my patients that don't have symptoms, but some symptoms to look out for. Alarm symptoms are symptoms of rectal bleeding, a change in your bowel habits. If you're somebody who goes like clockwork every day at 5 a.m. after your coffee, and all of a sudden you're having constipation and you're only going once a week, and this is lasting more than a week or two, there's an issue there. You need to get that looked into. Diarrhea. If you're having abdominal pain, if you're having weight loss without trying, if all of a sudden you're having lots of weakness and fatigue and you cannot figure out why, these are all what we call alarm symptoms, and you need to get checked out. All right. I think the biggest barrier to this cancer is that we just don't get our colonoscopies done in a timely manner and like we're supposed to. If we could all get on board with that, we would be able to kick this thing.
Well, Dr. Powell, we know we only have you for just a couple of more minutes. And as I listen to you going through all of the risk factors, and as well some of the other underlying conditions that we as a community or culture have, and you hear people say, well, I don't have colorectal cancer in my family, so I should be okay. If cancer in general is in your family, shouldn't we be a little more seriously and proactive about going ahead and getting the colonoscopy, even if cancer or colon rectal or colon cancer may not even be an issue?
Yes, ma'am. And what I tell people when they say that is it has to start out with somebody, right? So you may be that somebody in your family. And that's why you just need to get screened on time, starting at age 45 or earlier. If you have a family history, get it done. It's no big deal.
Get it done. Get
It's
it done.
totally-
There's a campaign by itself. Get it done.
Yes, ma'am.
I have two final questions.
Yes.
One, that patient that comes to you with fears of the process of the colonoscopy, how do you encourage them to go on? One, and two, what else is there out there besides that big old gallon of Go Lightly? Do the GIs recommend to clear the bowel?
Yes. So I say that Go Lightly is for those old school docs. I do not torture anybody with Go Lightly. Okay.
Bless you. Yeah.
Are much less.
Amen.
And the preps that I use are actually only 8 to 10 ounces of the actual laxative. You take half in the evening, the other half a little later in the evening or first thing in the morning. They are much more tolerable. It's not that much to drink anymore. Don't taste that great, but this is one day out of your life where, yes, you're going to be spending lots more time on the toilet. It is one day out of your life to save your life. Okay. And people are concerned about how are they going to feel afterwards? After that scope has been up there, you feel exactly the same. It's like we've never even been there. Okay. You have the worst part is the prep, but like I said, that has gotten significantly better over the years. And the preps that we use are very tolerable and a lot less to drink.
Awesome.
No Go Lightly up in here.
No Go Lightly. Love that.
So what final tips would you provide to our community that has maybe less access? They're not uninsured, but they may be underinsured. They've heard of a colonoscopy, has no idea how to connect with a GI or how to get the process started getting a colonoscopy. What tips would you provide to people who just don't know how to get this started?
Right. I'd say the first thing is being proactive when it comes to your health and really paying attention to your body. I tell my patients that they need to be not a stargazer, but a stool gazer. Pay attention to what's coming out. Okay. Is it black?
No.
Blood in it? Are you constipated? What's happening? If you notice a change, you need to get that checked out. If you don't know where to go, then most times you can call your primary care physician. They'll be able to direct you. However, most insurance companies these days do not even require a referral to see a GI physician to get a colorectal cancer. And so you can literally just Google us, Google GastroMD, Dr. Donna Powell, and we'll get you taken care of, get you squared away.
All right. Well, we will make sure that your information is also disseminated out to our radio listening audience. And let me take this opportunity to share with our audience. We've heard all of this potent information that you're giving us today. Simple things that people can remember. Get it done. Just get it done. And go ahead, be a stool gazer. Pay attention to what's happening with your body. I love that because this is what's going to allow us to be able to connect with family members and especially the younger generations. So one of the things I wanted our radio listening audience to hear and know about you, the best part of Dr. Powell's day is when patients express how much better they are feeling. She strives to teach each and every patient as if they were her own family member, which contributes to the excellent care of her patients. And I tell you, you've relaxed me already. And I appreciate that. And I thank you. And we will share this information. The world will be able to tap in and hear what you have to say today. So before Dr. Davis comes back, let me just say thank you on behalf of our show for joining us today. And we look forward to having you back, Dr. Powell.
Oh, most definitely. Thank you so much for having me today. Everyone take care. Have a blessed day.
Thank you again, Dr. Powell.
Thank you. Bye-bye.
Colorectal Cancer Month. She, oh my God, it was just like, she reminded me of one of our therapists that came on, the girlfriend therapist.
Homegirl therapist.
Power.
Yes.
Yeah, homegirl therapist.
The homegirl therapist, right.
The homegirl therapist. And so we're going to now take a segue after we leave that feeling of speaking to the homegirl therapist. This expert that we have coming on the show, Dr. Clement Gwede.
Yes.
He is all about the business of, and he has 3 important steps that he's going to share with us. And let me take this opportunity to welcome Dr. Gwede back to the show. You're no stranger now.
Thank you. Thank you. Yes, if you appear on a show twice in 4 weeks, you are not a stranger. Thank you, Cheryl. Thank you, Dr. Davis.
Thank you.
It's the message. It's the message, Dr. Gwede. And you've been sharing with us before. And Dr. Davis comes on every second Wednesday, the second hour of our show, and brings awareness to all sorts of diseases and conditions and problems. But she comes with solutions, and part of the solution is to bring the best that we have to offer, not just in the Tampa Bay area. She will go abroad if necessary. So, Dr. Gwede, we had the opportunity to introduce you on our last show, but we do want our radio listening audience to know where you are and where you're coming from. A Moffett researcher, Moffett Cancer Center, yes. A friend to Let's Talk Business with Cheryl Jacobson, and my co-host, Dr. Shanae Davis. You're responsible for health outcomes and behavioral programs. And that says a lot, but we want you to kind of explain to our radio listening audience what exactly that is. Now, we know as a senior researcher in health outcomes and behavior programs at Moffett Cancer Center that you are dedicated to understanding, and this is what I love, why disparities in cancer exist, and consequently, how to develop solutions to address them. So, Dr. Gwede, I want you to come in, and Dr. Davis will have something to say. But listen, we're going to take the first 5 minutes because we're going to break for a commercial at 1, and at that time, you'll be able to, leave Moffitt's logo there. But we don't want to get too involved in the next 5 minutes. Dr. Davis?
Indeed. Thank you again, Dr. Gwede. Let me first help our radio audience understand the depth and the importance of Dr. Gwede just before he even speaks, just in his name and in his credentials. He is from the continent, I like to say. He is a native Zimbabwean gentleman, and he's also not just a researcher. He is a nurse scientist. And
yes.
And he's a fellow of the American Academy of Nursing, by the way. And of course, as a nurse practitioner, that's just near and dear to my heart. The way we are trained is in more holism versus a cure focused model. And we understand even before, we are in for our master's programs, in for our PhD programs, that often, those that have, their basic resource needs unmet, they're just not able to focus on any kind of preventive behaviors or, getting your medicines and things like that. You got to have somewhere to stay. You got to have, feel safe. You got to have something to eat before you get to those other factors. And in this behavioral research that Dr. Gwede has his focus in, that's been pretty central, not just to colon cancer awareness, but other cancers likewise. And when we can figure out what those barriers are, address those barriers, and meet those basic needs of patients, or even direct them towards places and resources to have those needs met, then we can focus on the health aspect. And Dr. Gwede, could you just tell us a little bit more about how all of those ancillary things, sometimes unaddressed, affect one's cancer risk?
Absolutely. Thank you, Dr. Davis, for that introduction, teeing it up right on. So let me begin by saying I'm from the continent, like you said, but I did most of my education in the United States, and including being a graduate of the University of South Florida College of Public Health, where my master's and my PhD focused on health promotion. So hence the health outcomes and behavior. Learning how to motivate people to do the things we know help, to do the things we know work, to do the things we know can reduce that gap and that burden of disease in the Black population. Having said that, it's not easy. We all know it's not easy. But if you can be healthy in general, you can also help prevent cancer and many, many other diseases. So we're not asking people to do things in isolation. We are asking people to be aware, to be active, proactive, and do things that promote health. With that said, in my work at Moffett Cancer Center, where I've been for over 28 years now, or near thereof,
Congratulations.
Wow, I didn't realize that.
Thank you.
Congratulations.
I grew up there. I joined when I was very young. I am currently focused on taking what we know works for cancer prevention and control, preventing cancer, detecting it early, and making it really beatable and a thing of the past. We are working on it. But my work is focused on taking those things we know and translating them into behavior and solutions that can help not only the people who can afford, who have the access, but the people who do not have access, or who have those social determinants, who lack health insurance, who don't have a medical home to be talking to a provider or a physician, a doctor, and to be able to navigate people who need that kind of help into the system and into specialty care. For colorectal cancer specifically, I'll talk about some of those opportunities, but that is indeed where I'm coming from. I'm coming from trying to reduce the gap, level the playing field, so to speak, and make everyone benefit from the discoveries and the knowledge we already have.
Indeed, indeed. So on the in the research area of Moffett, I love that you broke that down: prevent, detect, control.
Yes.
In the African American community, there's such high prevalence. Dr. Powell mentioned some of those risk factors that are modifiable. We can definitely start there, but if we don't understand, there's a model, the health belief model, that indicates that if you don't feel, you know, a particular variable is a threat to your health and well-being, you're less likely to do something to prevent it, or to even act in that way at all, because you don't perceive it to be a threat.
Yeah.
So your work is really important in helping to identify those unhealthy eating habits, those sedentary lifestyles, just environmental things, smoking, etc. All of those risk factors that increase our risk and that we don't see as a threat. We need to identify those as threats to our health, and with them on board, we are at greater risk for cancer. And
Well, Dr. Davis, we're going to do just that.
It's important.
We're going to take care of those risk factors as soon as we come back after the break. See you in 2.
It may be hard to believe, but people just like you are already saving money. FeedThePig.org makes it easy. Their simple savings plan teaches you how to start saving without going overboard, so you don't need to start foraging wild berries.
I was skeptical, but these are actually pretty good.
You don't need to sell your soul to the devil.
$15 is the best I can do.
You just need FeedThePig.org. Don't get left behind. Get tips and tools at FeedThePig.org. Brought to you by the American Institute of CPAs and the Ad Council.
Welcome to Calvin's Barbershop.
You all gotta see this.
I don't even want to know what you're looking at on that phone.
Well, you should. I was learning about the dangers of high blood pressure and that we need to get ours checked regularly. High blood pressure can increase the risk of heart attack or stroke, but this text program can help keep it at a healthy range. Just text barbershop to 97779 to sign up.
I'll get right on it as soon as I'm done with this baby panda video.
Text barbershop to 97779. A message from the American Heart Association and the Ad Council.
Slap talk, trap talk, just talk with Madam CJ. Right here on In Touch Radio every Thursday at 7 p.m. Talk to me, baby. Trap talk, y'all, on In Touch Radio.
And we are back, and to our radio listening audience, we're just about to hear more about the risk factors coming from Dr. Gwede, and he has so much to share with us. So Dr. Davis is going to just delve right into it.
All right. So I was looking at one of your publications, Dr. Gwede. You're on a systematic review that looked at many African Americans over the past couple of years, their habits on screenings, looking at what barriers, were in place to that they felt that it just helped to discourage screenings, to address those. Pretty large study, looked at over 650 studies, and about 11 I see were narrowed down for the review. Can you tell us about what you learned? What were some of the barriers that emerged from that review? What things is Moffett doing, and what are they promoting to local providers in order to overcome some of those barriers and increase the amount of African Americans that are screened?
Yes, thank you, Dr. Davis, for pointing out that study. So what that study really looked at was trying to figure out what are some of the strategies that work to reach and engage the Black community in cancer prevention for colorectal cancer. So we looked at a number of studies and did a deep dive in 11 of them, and they covered studies that were done in churches and faith-based institutions, in barbershops and other settings, and a number of different community settings. And the take home was, depending on the setting and depending on the intervention that was being done, whether it was promoting and giving access to screening, that number one, the community is prepared and ready when access is provided. So that's the first barrier, access to screening modalities for colorectal cancer, for example. The second barrier is knowledge, knowing why screening is important, when to be screened, and having the plan to talk to your physician or your doctor or your provider wherever you seek care. The third and most important part of this is that physician recommendation is very important, or provider recommendation is very important, because that's the thing that allows us to know that this behavior is important and will save my life. Having said that, most of our community members who are uninsured or underinsured do not engage the healthcare system enough. So at Moffett, we are beginning to do outreach-based studies, including the one that I'm going to talk about called Screen to Save, that leverages the fact that we have many community clinics that can provide care, particularly colorectal cancer screening, using those FIT tests that we heard about. We want to get people to engage with the health system. So our education program at this time promote and facilitate people getting access to care so that they can receive the FIT screenings and the follow-up colonoscopies as needed and prevent or detect colorectal cancer early. We feel that leveraging that infrastructure that exists, like the federally qualified health centers, will really allow Moffett to expand its reach to communities in corners that we can't reach directly. And that strategy results in sustainable care.
Yeah.
I love that. I love that. Let me ask you something a little testy. In this, research, they went to churches and barbershops and those epicenters in the African American community, of information to try and take, health information there. So they went to assess those areas. Our last guest, Dr. Powell, she just went out on her own. She's a African American woman provider. Um, Sometimes that's really important. Your the place that you get the information is really important. So that provider, relationship and being ethnically matched sometimes is one of the drivers of patient motivation. Tampa Family Health Centers is one of the largest providers of healthcare for and under insured patients here in Tampa. But have you reached out, or does Moffitt have a relationship with, some of the independent or other organizations to touch those, ethnic providers to assist in motivation and getting the word out? What else is being done to touch those minority providers?
Yes, absolutely. So the efforts in our community education and outreach is to create a number of different partnerships, including the ones I talked about with federally qualified health centers, with other health institutions, such as Advent Health and so on and so forth, in order to be able to create referral pathways that allow for continuity of care. With that said, when we do outreach or we do projects such as these ones that we're talking about, we found out that a one-way relationship doesn't quite work, right? So we educate the community and then link them to services that are closest to them. Most of the care that people have, whether it's for cancer or for other reasons, is in their neighborhood. So we really want to leverage that neighborhood clinic, that neighborhood healthcare system to be the primary place where people go, then they can be referred for other things that need to be done at specialty centers. So for colorectal cancer screening, for example, we can provide these screenings at the neighborhood clinics because the fit kits are much more readily accessible. But for mammograms, you may need to go to a facility that has that specialty machinery to do that. So again, the whole idea is to focus on sustainable models, not models that will go away when our research leaves.
I love that. I absolutely
excellent,
love
excellent.
that. So focusing on that community approach, getting the word out to everyone so that the patient can actually have a more substantive conversation with their providers. I think that is a great approach. The FIT test versus the FOBT. Dr. Powell mentioned those, but when I first heard about that in our preliminary interview, Dr. Gwede, I thought that to be a really, really important difference for you to share with our audience. We hadn't heard about a FIT test. We hear about the stool, FOBT, occult blood testing. Tell us the fascinating difference in those tests.
No, I think Dr. Paul covered most of the differences, but I want to emphasize a couple. So the fecal occult blood test is the old generation way of technology. The FIT fecal immunochemical test is very specific, looks for human blood in your stool, not coloring from food and other. That's why when you do the FOBT, you have to have these restrictions. Can eat red meat and so on and so on, because the test gets confused. It looks for color red. The fecal immunochemistry test is very specific. It is also has much more sensitivity, meaning if it quacks like a duck, it's probably a duck. So it'll label things, but it's much more accurate, meaning specific for human bleeding or bleeding due to cancer or other causes. The challenge at the end of the day is after an abnormal stool test, you still need a colonoscopy. So for our uninsured, underinsured, that has been sort of one of the barriers we are trying to address through research, through linkage, through connecting people to access, so that we engage them with education, we link them to screening with FIT, and facilitate completion of colonoscopy.
I love that. I love that. I think that is so important. I don't believe that anyone has ever said to me, and I've actually gotten a tip today myself. I hadn't said to my patients before that they need to, restrict red meat, maybe beets and other things that are red from their diet, maybe a day or so before they intend to do their FOBT test. Those testing kits that we get from Quest and in LabCorp that patients take home, they may be the fit, the more specific testing, but we just don't know. I've never asked that question, so I definitely have learned something today. Um, Moving to the new research, the Screen to Save Cancer Education study. I love that this is a new focus that Moffett and you as PI are doing now. I want you to tell us more about that, and if there's some more findings that requires a colonoscopy referral. If there's any tips that you can give any providers listening on how to put patients in that pipeline, we'd like you to go there also.
Absolutely. It's a pleasure to talk about this particular study because it's just received what we call Institutional Review Board IRB approval to launch the study. So what the study is a partnership across the nation that is being convened by the National Cancer Institute, and Moffett is participating. And we are enrolling people from our 4-county area, Hillsborough, Pinellas, Pasco, and Polk, particularly, in order to educate individuals, refer them to their nearest local clinic or physician if they already have one. If they are not engaged in the healthcare system, we'll tell them what is the nearest FQHC or federally qualified health center or community clinic next to them, and hoping that they can access this FIT screening there. And we will also follow up to see whether they did it or what the results may be. Within that conference is working with that framework of saying the care can be delivered in your neighborhood. And if an abnormal is found, finding is found, then you can get help accessing the follow-up colonoscopy that you need. And Moffett has programs that range from linking you to Hillsborough County Healthcare Plan, as well as to linking you to colonoscopies at Moffett where it's indicated. So the goal here is to engage people, provide them access to screening, and provide them access to complete that follow-up so that nobody is left hanging, so that we can provide a complete pathway to care from screening, early detection, and to treatment so we can beat this disease. So colorectal cancer, I think we heard before, it's preventable, detectable, beatable. And that is the paradigm we are using and leveraging the community resources to try to make sure that the underserved communities will benefit just as well as those individuals who have insurance and other ways to access care.
Awesome. I'm looking at your poster. I'm sorry, Cheryl, I'm just going to ask this real quick. I'm looking at the poster because I think it's really important that we promote African-American participation in research studies. Obviously, we all know the history that we weren't really, fairly considered, in the past or treated ethically in the past. But when there is, protection, when there are protections in place, we got to do our part to help to change the attitudes of our community. When we have research involving us, we can put a message out about us. So we want to promote participation in these studies. Your study, that said, your study inclusion here, we're on the WHO on this poster, and it's a part of our screen here. It says between 50 and 75 for inclusion criteria. we now know that those numbers, that age requirement is a little bit younger. And then we sometimes as African Americans see colon cancer younger. So how did you come up with that inclusion criteria? And are there any exceptions being submitted to IRB for younger people to participate?
Yeah, absolutely. Good question. So we are in other studies using the age 45 consistent with the recommendation, because this study is coming from NCI, and the United States Preventive Services Task Force had not yet admitted 45 at the time, so that change hasn't been made. But it's something we are talking about and something we could easily amend when the time comes. In all our work, we follow the ACS or the most stringent guideline when we can. So 45 is included. It's just that when we send data to NCI, for those who participate in this research, we have to follow that guideline. But it's point very well taken. The guidelines are now 45. All our other studies do use age 45.
Okay.
And this is not just specific to African Americans in this particular study, but we have done many, and we are coming to programs such as these that will reach the Black community more readily, to make sure that our Black population is getting the opportunity to participate. So there's a phone number on that flyer. The number is now open. Please do call, and the Spanish version is coming.
All right.
Well, we will. And thank you so much. Thank you, Dr. Davis. Now, Dr. Gwede, and a couple of questions coming from our radio listening audience. As you were just talking about all of the outreach that Moffett is getting ready to do or is doing, what is the best contact we should, or a person listening to this show today want to know more information about what Moffett is doing? What would be the primary number they should call for outreach services? Is that something we can add to?
Yes,
well,
we
let's do
can.
this.
Let me email you with that best number, because the operative word is in best number. I
There
gave
you
you
go.
one
And
number
that's
you can
important, too.
call.
Well, we will put that with our thank you post, because we do have individuals listening to the show. And now I want to go to another question. This comes to us from Janet Kitchen, one of our viewers, and she wants to know, with the screening, does Moffett provide free screenings if you're uninsured?
The answer is yes. If you go through a qualification process, and the answer in general, in short, is yes. We have programs that allow for people to be referred in and evaluated. And like I said, many mechanisms, including the care that Moffett provides for the free for those who qualify.
And that's going to be one of those key numbers, too, so that we can share this information, since the questions are coming in to us. And actually, these questions are coming to us from Facebook. And so we have another question. And this is there no concerns of colorectal cancer being maybe hereditary? And what age? And you kind of covered this a little earlier. Should one go for screening if you think it's hereditary?
Yes. So the key thing we look at in terms of the cancer that runs in the family is whether there's a family member, but that also requires that you know your family history. So that's the important part. It's not enough to say someone died with cancer. Who died, what age, what cancer, as has already been said. Once we know those facts, the clinicians and the researchers can really determine whether you are increased risk or whether you are average risk. So the 45 and above, the recommendation is for people who are average risk, no strong family history, and so on and so forth. The ones that have strong family history are those who are below the age 45. So if I am to give one important message, know your family history and know the specifics, and talk to your providers about it. Then a plan can be developed that is right for you and the right test for you.
That is awesome. Thank you so much. And thank you to our viewers, Aaliyah Ray, and the questions that we can't take them all, but we certainly wanted to get a couple of them in. And I appreciate the answers. The key is going to be in individuals or the community knowing who to reach at Moffett for the types of services. And they can always, reach out to us as well. That's why we have the show, in order to disseminate information to our radio listening audience. Thanks, Dr. Gwede. Dr. Davis?
Yeah, I just wanted to also emphasize there what Dr. Gwede said. You know, you have to know your family history, but then you have to tell your provider. You have to communicate your family history to your provider because, you know, we don't expect the patients to know, you know, what to do or with all this, you know, information in terms of, you know, what the guidelines are in terms of screening. If someone in your family has had, especially a particular first degree relative has had colon cancer, that means you need to be screened 10 years before that. And if your provider does not know who had the colon cancer and when they had the colon cancer, it's hard for your provider to make that recommendation for you. So just wanted to emphasize that part.
Absolutely. I want to go out with one other message that
Okay.
colonoscopy is very doable. It's easy to do. It's very important to your screening. But if you cannot get a colonoscopy, get any test. The fecal chemical test will save your life. So don't pass on screening because you're waiting for a colonoscopy. Get the test that you can get at the time. The best test you can do for colorectal cancer or for colon cancer screening is the one that you can get done while you're waiting to do the best test or the more thorough test. So with that,
Oh my goodness. We've heard it from both you
So-
and Dr. Powell. Get it done. We
get
can't
it
emphasize
done.
that enough. Get it done. But to your point, the three important features that you wanted us to take away from this particular interview, and that is colorectal cancer is preventable.
Preventable, detectable, and beatable when found early.
Mhm.
Beatable through
Key.
treatment when found early. I did the colonoscopy myself. I don't feel a change. I still feel the same guy that I was, but I did have some anxiety, no question, but it's very doable.
Well, we are going to ask you at what age that you have it done, Dr. Gwede.
Right, or like clockwork. I practice what I preach. At the
Absolutely.
time it was 50. When I turned 50, it took me a couple of months to get my feet into the water because of the fear of finding cancer, but I got it done at age 50.
And that is so very, very important. And those are great tips for us to be able to take away. Again, before Dr. Davis comes, let me take this opportunity, Dr. Gwede, to say thank you so much. You are now a friend to the show. A special thanks to Moffett Cancer Center, which has been a supporter of Let's Talk Business with SJC. They are also a supporter of DSI Black Pages, and they have supported the publication for many, many years and featuring African Americans and letting us hear a little bit about their experiences with not just colorectal cancer, just cancer in general. And we know that you are extremely busy, but for you to take the time out to share with us the importance of it, and to quote you, no one should have to die from colon cancer.
Yeah.
I totally agree. I will stand by that statement, but I want to add, but we must do our part, right?
There is
So
a
do your
disclaimer.
part.
You must
Do your part.
You must do your part. And with that, again, we say thank you so much. I'll give final thoughts to Dr. Davis, and then we'll come back in and do our announcements. Dr. Davis?
You know,
Thank you.
Dr. Gwede, you just read my comment on you know, Black men and their attitudes towards colon cancer, and you just went, you know, right into it. Thank you so much for the time that you've taken today, and also bringing the education study to our listeners and to our viewers. I did so happen to pull that number. It's 813-745-8864. That's 813-745-8864. If you want information or are interested in participating in the Screen to Save project, we need representation in these research studies so that we can speak to what goes on in our communities, our risk factors, and how to prevent things. We thank you so much to you, Dr. Gwede, and give us these tips on prevention, early detection, and certainly, any new information that you have on how cancer can be controlled, you're welcome to our show. We love having
Absolutely
expert voices on to inform our listeners, and we just appreciate your time today.
Thank you so
Absolutely.
much. I'm looking forward to coming back. Perhaps not too late,
Yeah.
but next year.
And it's going to be hard to get you. One day we'd love for you to come into the station, but as a result of COVID, I know it's easy for us to conduct these interviews, and you get to stay right in your office, right on the campus of Moffett. But one day you'll have to come over here to our campus and actually put the headphones on and be guests within the studio. But listen, while you're still here on our campus today, and you will appreciate this as well. On our campus today, one of our collaborators, we call it our little Black Wall Street here. It's our Wakanda. We have a company that's the American Mask Surgical Company, and they are producing surgical masks, and they're supplying masks to so many of our businesses within the community. They are having their ribbon cutting ceremony today. So if you happen to be in the neighborhood of 5508, drop by and support them. There's swag bags there. You can pick up your copy of the Black Pages also while you're there. Now, you mentioned the importance of us knowing our family history, being specific about our family history. Well, I do have to take a moment on a personal level, because I would not be a good grandmother if I didn't. And so Dr. Gwede and Dr. Davis, you all can wish my granddaughter a happy 5th birthday. Happy birthday, Yana Ray.
Happy birthday to you.
And so look at it. She is a birthday princess for sure. So again, thank you to our partners, Moffett Cancer Center, Dr. Gwede, we appreciate the research, looking for that visit to come back. Dr. Davis, we appreciate you, your best you. Please like and share. We need you to get it done today by liking and sharing this post so that everybody gets to hear what Dr. Gwede has to say about colorectal cancer and what we need to do to get it done.
Call that number. Call today. We have operators waiting to answer.
We have to.
So thanks also to Dr. Powell and the Gastro MD practice again for her participation and information on colonoscopies earlier. And certainly we look forward to her coming back when she can finish up some colonoscopies.
Absolutely. This show is a wrap.